Well, ladies and gentlemen, it's time for our last panel of the morning, where we are going to talk about recovery and resilience for this great discussion titled Finding a Path to Collective Healing. We are very happy to welcome Monica Kaisia as moderator and her two panelists, Johanna Benesti and Tori Tsui. Please give them all a very warm welcome.
Welcome, ladies and gentlemen, to this last session, this last conversation that we're having before the lunch break about global health and collective healing. And sometimes we tend to forget that because our life has become so normalized by now again, but we have witnessed not a long time ago the arguably biggest health crisis the world has ever seen, and the world had to come together and did so, sometimes better, sometimes worse, to address the COVID crisis. And the pandemic has taught us many, many lessons, which we really need to take on board now to not only prepare for what is likely going to happen as the next crisis, but also to learn more broadly from what we experienced in this pandemic. And at the same time, we do have another crisis going on, which is the global climate crisis. And there too, we know that individual action, country action, national action is not going to get us very far. What we need is collective action and collective healing eventually from both of these crises. So my name is Monica Kaisia. I am head of the Social Policy Division at the OECD, and I will be moderating this session with two absolutely brilliant speakers, which I will introduce now. First, we have on my far left, Johanna Benesti. Johanna is a core member of the Boston Consulting Group's healthcare and social impact practices. She leads the firm's work on global health, as well as BCGX in France, which is the tech arm she just explained to me. She has worked with leading healthcare organizations, both private and public sector, on advancing equitable access to healthcare products and services in high-income and in low-income countries and middle-income countries. So basically everywhere around the world, Johanna. She has extensive experience partnering with social impact and UN organizations dedicated to improving public health. And her work has also included supporting global strategies on maternal and child health, malaria, immunization and HIV, and setting up access programs for vaccines. Then we have Tori Tsui. Tori is a Bristol-based climate activist, speaker, and consultant from Hong Kong. And Tori, you're the co-founder of the space Bad Activist Collective, wonderful name, Bad Activist Collective, and a member of the Climate Coalition Unite for Climate Action. Prior to this, Tori sailed across the Atlantic with a think tank Sail to the COP. She was sponsored by Stella McCartney after being named an agent of change. Tori's work centers around climate justice, making sure that climate policy, action, and organizing is intersectional, inclusive, and transformative. Alongside organizing, she's an advisory board member of the Earth% Group, Climate Resilience Project, and a strategist with Hero Circle. Lots of different things, Tori. So let me start this conversation with Johanna. Johanna, as I just said, you have a very long experience working in the health sector with clients and with countries, both public and private sector around the world. The pandemic, what are you seeing? How has this actually changed the global conversation around healthcare systems?
Thank you. I think when the pandemic happened, it happened in a very specific context. It happened at a time where we had much more access to data and information than before. So the level of conversation that we could have, the level of information that we could have was very different. That's one thing. The second thing is that the pandemic hit low middle income countries and high income countries, I wouldn't say alike, but hit both. And we in high income countries have experienced inequities in a way that we had not experienced before. If you combine both things, we've all experienced it in our flesh, what lack of access to healthcare products and services meant. And we had access to that information and data, knowing what was going on in the world. Add to that the fact that it exposed the interconnectivity of the world and the fact that when there is a health crisis somewhere, it impacts economy in another part of the world. And so you can't really say, oh, it's not my problem anymore. If you put all of that together, I think the big change was the realization that health equity is something that matters to all of us. And it's not just in low-middle income countries, it's actually next door as well. Underserved populations are in high-income markets and low-middle income countries alike. And it's not just, it's a number of things. It's rural populations, it's gender, it's diverse groups, it's minorities, it's a number of things. So that for me was a very big change in how the conversation is shaped. And then the fact that you need to answer that in a systemic way. So it's not just one actor, it's not just pharma, it's not just governments, it's individuals, civil society, communities, pharma, it's diagnostic companies, it's governments alike. And to that we borrow a lot from the climate discussion, because the climate discussion has never really been a single actor discussion. So we keep looking at one another and trying to learn from one another.
And in very concrete terms, so we've learned, we've seen this, and it's true that for us it was completely surprising, for example, that we couldn't get tests. You have to remember that we couldn't get tests, we couldn't get vaccines, we were waiting, we had no idea what was going on. For industrialized countries, for OECD countries, quite a new experience that suddenly this access is no longer there. Are you seeing a real change now in using this experience for concrete action? Or are we kind of leaning back saying, now it's over, we can relax?
No, we're not leaning back and saying it's over. So yes, there is this awareness that our health systems, we're very lucky and privileged in high-income markets to have the health systems we have, but they're still very fragile, very weak. We've tested their limits in a sense. So everything related to cost effectiveness, to improving access, to resilience of our health systems is much more important right now and much more front and center in the discussions than it was before, partly because of that risk that we've been exposed to, partly because of what we went through. So it means that it's been an accelerator for AI in health systems. It's been an accelerator for looking at different ways of providing services and care and tapping into different resources, so much more multi-sectoral discussions and multi-stakeholder discussions than we used to have. And the driving force for that is also I see the conversation changing in the public sector and in the private sector, where they're actively looking to partner and to change that. So equity much more front and center, health systems resilience much more front and center. And we have a set of new tools that we can use to activate that. That's the discussion with multi-stakeholders, that's AI, digital, and passion and drive of individuals.
That's very encouraging. I think that's great that we have such an optimistic outlook that a bad experience actually changes things. Tori, Joanna was just mentioning there's a lot to learn from the climate movement, which has been going on for a long time, but there's also a connection on the topic of health with climate, because we know that climate change, the climate crisis does affect healthcare. And maybe just a very few numbers from our OECD Health at a Glance projections, we've estimated that outdoor air pollution may cause between 6 and 9 million premature deaths a year worldwide by 2060 and cost 1% of global GDP as a result of sick days, medical bills, and reduced agricultural output. So in your climate activism, which we've seen is on many fronts that you're fighting, which is wonderful, how do you connect your activism to the health topic, and how easy or difficult is it to get people focused not only on the nature change, the climate, but the connection to health?
Thank you. I want to start by saying that I focus a lot on the transition away from fossil fuels. That's actually my primary focus these days. I'm working on a climate litigation case against an unlawful oil field in the North Sea in the UK called Rosebank, the emissions of which will total more than 28 of the lowest income countries. And then I'm also an advisor for an organization called the Fossil Fuel Non-Proliferation Treaty. So I want to focus on fossil fuels. Now, similar to the Framework Convention on Tobacco, the Fossil Fuel Treaty emphasizes that fossil fuels are a harmful substance to human health. And we see that manifesting in many different ways. You mentioned air pollution, whether it's cardiovascular disease, cancer, respiratory illness, as well as climate crisis exacerbating wildfires. We're seeing that air pollution is something that is directly related to fossil fuels. And we're also seeing the impact on people's mental well-being, which is a huge focus of my work, and we can get to that in a second. But depression, for instance, is the leading cause of disability worldwide, and we're seeing more and more this emerging field of eco-psychology, which talks about the impacts of the mental health and climate crisis as very intertwined. We're also seeing the impact of what I call unnatural disasters, which are very much owed to many of the sort of polluting substances of fossil fuels. And in that regard, we're going to be seeing more famine, more food insecurity, more mass migration, which is only going to exacerbate global health inequality. There's also a lot to be said about the disruption to global health systems and the preparedness that we have in the face of crisis. You know, we're seeing catastrophes worldwide and people not being able to access adequate healthcare, and that inequality is only going to worsen. There are a lot of different factors that contribute to the way that, you know, we're experiencing ill health. And I think it's really important in the climate conversation to realize that this isn't a separate issue. And I talk a lot about intersectionality, which is, you know, a framework developed by Black feminist Kimberly Crenshaw, which understands that you cannot pry apart these oppressive systems, you cannot pry apart these different categories. And in the context of climate change, it's inextricably linked to health. And arguably, you know, it should be a priority now to really focus on the impacts that the climate crisis is going to have, but also what's happening right now, because this isn't something that is, you know, in the distant future. It's very much the here and now. And insofar as how we can kind of engage people, I think health is a universal language, whether that be somatic, physical, mental, is all interconnected. And I think we need to deviate from this Eurocentricity of separating these components, because ultimately we are kind of a somatic and physical whole as well as what happens in our minds. And if we're going to strive to talk about this conversation, we really have to make sure that we're inclusive, that we're thinking about this in a sort of holistic viewpoint, but also making sure that we're not leaving out marginalized people in the conversation.
Tori, you just mentioned eco-anxiety, and you've actually written a book about it, which she will be signing later, so please do see Tori later when she signs her book. Is there something specific, coming back to the health debate, that you think needs to be done by healthcare systems to address eco-anxiety? Because, I mean, one thing is we have to change climate change to reduce eco-anxiety, but that might take a little bit of time, and in the meantime we see a lot of distress. So what should the healthcare system do? What should Joanna be consulting her client?
What should we do?
Exactly. What should we do on eco-anxiety?
So I may be biased because I obviously care a lot about the transition away from fossil fuels, but I really come back to this quote by Jiddu Krishnamurti, which says that it is, you know, no measure of health to be well adjusted to a profoundly sick society. And I think that really capitalizes on the systems change element. You know, I've spent a lot of time doing campaign work in the space of mental health, and so often I've been told, well, if you just modify this minute behavior of yours, if you prioritize your well-being, and I think this speaks to the conversation of collective healing, is actually there's a lot more that we can do in community, and I think system change is part of that. And so to go back to this concept of, you know, the transition away from fossil fuels, I would argue that's a form of mental health care, because it's directly related to the climate crisis, and more eco-psychological studies are coming out showing that a lot of people are terrified of what's happening, but a lot of people have also bore the brunt of this crisis for so long. And I think that in order to really make effective change, we need to see all sectors of society addressing the climate crisis as a means of tackling the mental health crisis as well.
Joanna, how can you take that conversation into the global health space?
Well, I wonder, you know, so health and climate are very closely related, and it works both ways, right? So the health systems contribute to the climate, you know, well, if you think of the supply chains, etc., health systems contribute to the climate change and to the impact we're seeing. And at the same time, climate is impacting health and disproportionately impacting, you know, the underserved populations in general. So because of the geographies, because of course, just the fragility of the systems they're in. So it's a close conversation. But when it comes to, I think the common thing is that when you want to resolve inequities and when you want to resolve a climate crisis, etc., there are things that are very long-term and there are short-term things that you need to do. And it helps people from their mental health to be in motion and to start seeing some change and to start contributing to that debate. So I'm far from being an expert in eco-anxiety, but I wonder, Tori, if you observe that if you start a movement, if you build on that momentum and start to put people in that positive mindset where they start contributing, then at least you can see some improvements, and improvement on the health and how they feel, and improvement on what's going on and the impact of climate. So,
yeah, absolutely. So I think there is a lot to be said about how we don't exist in silos, and this kind of notion of individual versus system change is often posed as a sort of a binary when actually there's so much overlap. And I've definitely noticed with some of the work that I've done with young people's mental health organizations that there is a sense of empowerment that comes from taking action, but there are studies that have shown that that is more likely to be sustainable if it's done in a collective space. It's not just focusing solely on individual action for the sake of oneself, and how that can actually create this real burden to be the change. There's also this sort of issue that we have with a lot of young people burning out who take it upon themselves to really be the source of their own healing, when in reality, like I've mentioned, we need to make sure that this is a collective space. But, I can speak from my own experience. When it comes to sustaining this work, there are definitely forms of self-care that I can practice which allow me to make sure that my work is sustainable. And I argue that sustainability is as much of a mindset as it is greening the planet. I think there is a lot of overlap there. But in terms of, as you were saying, kind of the short-term versus long-term, we need the systems change approach to really galvanize change in the long term, which is hopefully what we're on the path to doing.
We're at the Women's Forum, so we don't have a lot of time left, but I do want to ask both of you about the specific perspective on women's health. This morning we saw this shocking number in the barometer that 71% of women didn't get the health care they needed because they were women. So maybe I'll start with you, Tori. Eco-anxiety is, and in the mental health space, do you see a difference between young women and young men in particular, and how is there anything specifically that needs to be done to address women?
It's quite a peculiar thing, because if you look at the majority of environmentalists, most of them are women and people of marginalized genders, and so naturally they're more engaged in this conversation. And I think there's something to be said about the maternal instinct to care and the gendered instinct to care. And, as a result, you do see that skew of more young women and people of marginalized genders experiencing the likes of eco-anxiety. But it's almost kind of paradoxical, because men's mental health is also a huge issue. I mean, young men are those who are more predisposed to suicide, for instance, which is going to be exacerbated by the climate crisis. There are studies that have shown that heat stress actually increase levels of suicide and exacerbate pre-existing mental health illness. So I think there is something about the way that women collectively organize, which allows them to have this sort of resilience to avoid some of the worst impacts of poor mental health and climate change. And there are studies that have shown that communities that have more sort of collective healing practices and know how to mobilize in times of crisis are the ones who are going to be more resilient. And unfortunately, I think that a hallmark of a lot of Western society and neoliberal capitalism is very individualized. It likes to divide people and kind of take them away from community. So I do see the discrepancy, but it's not as black and white as one might think.
Joanna, your perspective on women's health. I mean, we've been focusing women's health for a long time was reproductive health. That was it. And we're missing a lot on we're uniformizing, and there's plenty of things that need to be done. Can you maybe outline a few priorities in your work to make sure that women's health is women's health?
Yes, it's so interesting. We focus on women. We know women are pivotal. We know that actually the economic impact of having healthier women is tremendous. And so it is by all means the right thing to invest on. We still focus on maternal health because women are the way to get the children, and because it's that moment that is so important. And we should. We're so far from all the objectives. We absolutely should. But then women are beyond being mothers. Before and after being mothers, they still are humans, and they still are humans who contribute tremendously to the economy, to the society, to everything. And so we should take care of that. If you look at research today, you see that R&D for women and R&D around women's health is terribly behind everything. So there is no specific R&D that addresses them. They're not included in clinical trials as they should, just in terms of, you know, overall products and everything. And then if you look at R&D and everything that happens after, so if you think about menopause and, you know, things like that, that's way behind. And, you know, and it's still not addressed, and it's still not addressed even, and again, I'm not talking about just marginalized populations or countries, but really everywhere. The science is way behind still. So it's first an R&D issue, an awareness issue. And I don't want to say that we should focus on that and forget the rest. The rest is absolutely needed, but we need to do all of that, because now we live more than just, you know, after giving birth.
Great. Thank you so much to both of you for outlining an ambitious but doable agenda, both for collective health and for global and collective healing. So thank you so much, and please don't forget to visit Tori and her book signing, and join me in a round of applause for our wonderful speakers.
Thank you.
Many thanks to all of you ladies, and I have to disagree with you slightly, Johanna. I didn't feel particularly human after having children, but that's another conversation, I guess, we need to have at some point. Thank you so much to the three of you. Thank you.